probably well before that, but that's the first written document, right, that established how to breathe in certain ways to have certain benefits.
Yeah, that it seems like it should be something that should be taught in our schools then, that it should be just as basic as learning to spell or to read. It's like, because that's like your lungs reading the universe. It's like your body reading the universe moment to moment.
Yeah, there's a lot of things that should be taught at our schools, right? Nutrition, exercise, like staying away from electronic devices at night. So, but I would put, we talk a lot about that, right? At least this is in the public consciousness right now, right? So we're having these discussions. Nobody's talking about breathing.
Yeah.
And even though kids, you can look at a kid there's a 50% chance they are breathing through their mouths. There's around a 90% chance they are breathing dysfunctionally. And so if you're breathing this way, it's going to affect your ability to focus. It's going to affect your oral health. We've also found if you're breathing dysfunctionally at night, you have something called sleep disordered breathing. It affects how tall you're going to grow. It affects your facial structure, all of these things. And I don't hear anybody talking about this. I thought that there would, I was so idiotic when this book first came out. I was talking at medical schools. I was blasting this message all around. I was like, oh, I'm really going to make some change here. I was completely ignorant. Nothing's changed. So people have to take this information and do it for themselves, because I don't trust, governments to really get this information out the way it should be distributed and accepted and understood.
Yeah, well, they just finished remodeling the food pyramid, so I think it's like, it takes a while for them to change shape, apparently. You said oral hygiene, and you mentioned cavities earlier. Take me through that.
Yeah, so I was reading, a lot of my job is spending time in these really creepy medical libraries, right, and looking through old literature to see what we were saying way back when, to see if it's right today. And so many different dentists and different people in medicine 100 years ago, 120 years ago, were saying the number one cause of cavities wasn't sugar, it wasn't carbohydrates, it was mouth breathing.
Wow.
And I said, I guess those guys were just old, they were stupid, right? But now the majority of dentists I talk to who study the airway say the number one cause of cavities is mouth breathing. Really? If you look at 50% of kids are mouth breathing. That's a high range, but around half of kids are mouth breathing, especially at night. Most kids are mouth breathing at night. To think that this could be the number one cause of their cavities, this is information I would think parents would want to know about. Right?
Yeah, it would be on billboards, you would think. I mean, that's huge. And the money that they would save them by taking care of their kids' breathing practices. What's causing kids to mouth breathe that much?
So we're born as perfect breathers, right? A healthy baby. Look at a healthy baby. It's a beautiful thing. Every breath, their stomachs